I'm Dr. Azhar Alam, and today we are going to discuss about common penile disorders. What is phimosis? Phimosis is a condition when the foreskin of the penis cannot be retracted back, or there is difficulty in retraction of the foreskin. What is paraphimosis? Paraphimosis happens when the retracted foreskin cannot be pulled back over the glans penis. It stays in a retracted state. What is balanitis? Balanitis is a condition when the glans or the tip of the penis is inflamed. What is posthitis? Posthitis is a condition when the foreskin of the penis gets inflamed. So these are the common disorders of the penile region, and the common solution to all of these disorders is a procedure known as circumcision, about which today we are going to discuss. So what is circumcision? Circumcision is simply a procedure in which the foreskin of the penis is removed surgically. What are the benefits of circumcision? The benefits of circumcision include, firstly, that it leads to improved penile hygiene. Secondly, there is a risk in sexually transmitted diseases, particularly after circumcision. There is a decrease in the risk of urinary tract infections in persons who are circumcised. Next, and most importantly, there are studies which suggest that people who have undergone circumcision have a lesser risk of developing penile cancer. And finally, another benefit of circumcision is it leads to lesser penile problems or penile disorders. So how do we do a circumcision? How do we remove the foreskin? Conventionally, we used to do open surgery in which the foreskin was cut and stitched, and it was a very bloody procedure, a painful procedure. Today, with the advance in surgery, we have two advanced ways of performing circumcision. One is via a laser procedure known as a laser circumcision, and secondly via a stapler known as a ZSR stapler, with which we call as a ZSR circumcision. So these two are the most advanced and minimally invasive procedures for performing a circumcision. So the two minimally advanced techniques for performing a circumcision are laser circumcision and ZSR circumcision. So in laser circumcision, with the help of a laser, we remove the foreskin, and there is absolutely minimum blood loss, and it results in excellent cosmetic outcomes. In ZSR circumcision, we use a stapler device wherein with the help of a stapler, we perform the circumcision, and it's done in practically within 5 to 10 minutes. There are staple lines all over the glans, which they automatically fall off within 7 to 14 days. The advantages of both these procedures are, number one, it's a daycare procedure. You get to go home on the same day. It's practically a bloodless and a painless procedure with minimum pain compared to your open procedure. It's done under local or regional anesthesia, and it results in a very rapid recovery and excellent cosmetic outcomes. There are a few questions which my patients often ask me regarding circumcision, and they want to know that after circumcision, will I be able to urinate properly? Absolutely. Circumcision, if done correctly, has no effect in urination. The second thing which people want to know is, can I join my office soon, or will I have to take prolonged bed rest? So with laser and ZSR circumcision, you can recover very rapidly and resume your normal regular work in 2 to 3 days without any concern. People wonder whether we need to do regular dressings after circumcision. The answer is no. You will be given an ointment which you will apply normally, but you don't need to take any extra measures of dressing, etc., particularly after laser and ZSR circumcision. And finally, people ask me that is circumcision a very painful procedure or a very bloody procedure? With the modern advanced methods, let me assure you, it is practically a painless procedure and a bloodless procedure, and you can go home within 2 to 3 hours of the procedure and do all your normal activities on the same day itself.